The anterior, superior, alveolar, and infraorbital nerve blocks. The ASA will be covered briefly first. The ASA penetration site is at the height of the mucobuccal fold anterior to the canine eminence in the area called the canine fossa. The needle pathway would be approximately 20 degrees to the long axis of the canine. The depth of penetration would be approximately 3 to 6 millimeters, and this injection would anesthetize the canine through the central incisor and the buccal soft tissue. The infraorbital nerve block penetration site would be at the height of the mucobuccal fold directly over the first premolar. The syringe barrel will be placed parallel to the mid-sagittal plane as indicated in the video. The depth of penetration would be approximately 10 to 16 millimeters. Extraoral landmarks are important for this injection. Move the patient's goggles out of the way and identify the infraorbital ridge. Notice the patient's pupil. Have them look towards the ceiling and palpate for the infraorbital notch. Once you identify the notch, you can move downward approximately 10 millimeters and slightly medial to find the infraorbital foramen. It is helpful to ask the patient when they identify a sensation. You can take your thumb, cover the foramen, and then retract with your index finger. This will allow you visibility for the penetration site. Replace the patient's goggles and repalpate for the sensation. Cover the foramen and retract carefully to view the penetration site. Have the patient open slightly so that you can identify the penetration location. Uncap the needle with a single hand. Note bevel and window placement is correct. Achieve stability. Identify the penetration location above the first premolar and make the syringe parallel to the mid-sagittal plane. Once you have deposited the bolus, you will massage for approximately 1 minute to allow the medication to enter the infraorbital foramen and provide pain management. Extended verbals for the infraorbital nerve block. Medical history has been reviewed and there are no changes. The vital signs are within normal limits. There are no contraindications for local anesthesia. I will be utilizing 20% benzocaine topical for 1 to 2 minutes and 2% lidocaine with 1 to 100,000 epinephrine with an expiration date of November 2018. I will also be utilizing a 27 gauge short needle. The injection is the infraorbital nerve block. This anesthetizes the pulpal of the central incisors to the premolars and also possibly the mesiobuccal root of the first molar. This also includes the buccal soft tissue of affected teeth, lower eyelid, lateral aspect of the nose, and upper lip. The insertion site is at the height of the mucobuccal fold above the first premolar. The depth of penetration is 10 to 16 millimeters. The deposit site is slightly anterior or superior to the infraorbital foramen. The landmarks are the pupil of the eye, the infraorbital notch, and foramen. The pathway is parallel to the mid-sagittal plane. The dose range is approximately 0.9 to 1.2 milliliters. Complications may include edema, pain at the injection site, hematoma, and possible transient numbness. During the injection, it is important to communicate with both patient and faculty. Communicate to the patient positive feedback. To the faculty, state when you have reached your landmark. State also when you are aspirating and the results twice, which would sound like aspirate negative, rotate, aspirate negative. State also when you are prepared to deposit solution.